Wash hands. Put gloves on. ID patient. Can I have your name? He says it's Chip. It is indeed Chip. I'm here to do your blood pressure. Is now a good time? He says it is. We're ready to get started. The biggest thing with this one is just being accurate on your results. We're going to have him lean forward, palm up, and we're ready to get started. Relax. This really should be at heart level, which we pretty much are at heart level here. And the biggest thing I want you guys to do correctly on this skill is make sure that we have our equipment set up the way we want it. Everything's is arranged before we start putting it on, and we got to be in a good sequence to be able to do this one. So probably one of the first things we're going to want to do is check out our gauge here and make sure that that's at 0. It is on 0. There's no air in our blood pressure cuff here, and I don't have any air in here. And we should check to make sure that we have the proper size. We'll say that this is the proper size for him. And then we want to take our bulb here. I'm going to take this and rotate this all the way to the right. And all the way to the right when we're holding it like this to make sure that that is tight. That way when we start to press on the bulb and we have this around his arm, it will put air into the cuff. There's a valve in here. Okay, all of this is set up. Then we want to make sure that this equipment is set up. This is a dual or a teaching stethoscope. So when you guys do this with me or with a tester or someone, your tester will be on one, you'll be on the other end. And of course we want to sanitize the earpieces before we stick those into our ears. Okay, sanitize your earpieces. The other person sanitizes their earpieces. And our equipment's almost ready to go. And then we're going to check this. We can do this later on, or we can do it before. We can do it a couple times. We'll place this in our ears and gently tap here. This is also a valve. We can turn this back and forth. You'll hear it click. I tap and I can hear it very loudly, so I know that I'm on. And then we want to be using this side, which is the adult side. This side is the pediatric side, okay? So all of our equipment is set up and ready to go, and we're off to a good start. Now we're going to want to place the cuff on the patient's arm, and on here it's going to say left and right, and we are on the left arm. We want this left arrow to line up with the brachial artery. Starts here, this is our radial side, it cuts across and comes to the inside. So if he's got his palm up, it's going to be right here. Okay, so this we want to line up right in here. We want to put this about 1.5 to 2 inches above his elbow. Place that there. Take this cuff, get that on tightly. It's not going to be too tight because he's a mannequin, but we'd want to have that pretty tight there. This is indeed pointing where the brachial would be. This, we should be able to, most of these cuffs, we're going to be able to latch this on. Not super tight there, but most of these we should be able to latch on here somehow. You can pull it down right like that too. Keep your arm there. And we're in place now. Okay, we've got this, the bulb is already closed. We place this in our ears. I'm not going to do it, but we want to place these in our ears. We've checked this. We could check it again to make sure we're on the correct side. A lot of times students come back and we're not listening to the correct side, and then of course we're not going to be able to hear anything. Okay, at this point, the next step that I want to do is check for the brachial. Okay, so that's where we're going to have to press. We're going to have to press very hard in here to be able to find it. And I found mine here. Okay, so we find the brachial as soon as we find his brachial. So when we find the brachial, it's much like when we're doing the radial pulse. We're going to press in here as soon as we feel it. You should be able to feel it pulsating. We're immediately going to place our stethoscope over that. Okay, if this is high enough, we should have enough room here in between the bottom of the cuff and the elbow. Okay, I place this there. I've got my earpieces in my ear and I'm ready to get started. Okay, I'm going to grab this. We're going to do the best we can to make sure that we don't have these cords touching, because anything that touches on here is going to reverberate and send sound up into our ears. So we want to limit that as much as possible. Okay, we'd have our second person there. We've got this here, and now we're ready to get started. We've already got this all the way turned to the right, and we're going to start putting air into the cuff. Okay, we pump this up somewhere between 160 and 200. And I'm allowing some air. I manipulate this open a little bit by turning it to the left. When I start to open this starts to come down. We have that at a speed about like that. We're listening. We won't hear anything. Hopefully when we start, we won't hear anything. And we continue to listen. All of a sudden, we're going to start to hear. When we hear that, we're gonna, well, that's going way too fast. When we hear that, we're gonna wanna look over here and see what number it is on the gauge. Remember that number, continue to allow this to go down until we stop hearing it. When we stop hearing it, that is our bottom number. We wanna look there, identify what the bottom number is. We release the air completely out of the cuff. We can take our stethoscope out of our ears. We can take the cuff off our patient. Set that off to the side. Take our gloves off, wash our hands. Report and record. The top number that we hear, we're going to write that on the top, put a line between, and the bottom number, when we stopped hearing it, is going to go on the bottom. Have to be accurate within 4 on the gauge.